although at 38, Dr. Kumar is a young researcher, at least to me, his innovative ideas and the incredible quality of his work have earned him national and international attention. He will lead what many are referring to as a dream team of nationally and internationally renowned scientists spanning computer science, electrical engineering, behavioral health, statistics, and medical science fields. I am pleased now to turn the microphone over to Dr. Kumar to give you a brief description of the center.
Thank you, Dr. Myers, for a very kind introduction. And we are all very fortunate to be here at this important milestone. So, as Dr. Myers mentioned, our MD2K Center, which stands for Mobile Sensor Data to Knowledge, is one of the 11 centers of excellence and one center for data coordination. The unique focus of our MD2K Center is going to be to address big data challenges that are associated with using mobile or wearable sensor data for monitoring and improving human health. Our team, for the next 4 years, will devote its efforts to develop innovative tools and the associated science so that it becomes easier to gather, analyze, and interpret health-related data that can be collected from wearable sensors. Our effort is expected to lead to innovative ways to predict and prevent complex chronic diseases such as congestive heart failure and smoking cessation, both of which cost a tremendous deal to our healthcare. Congestive heart failure is the largest cause of readmission today, and smoking cessation is the largest cause of mortality today in the US as well as in the rest of the world. So these are two very important applications that the center will target initially. Our hope is that with these tools that we are going to develop, it will become easier or it will become feasible to understand what goes on in a person's life when they are in the natural environment outside of the direct supervision of care providers. So that means it will become possible to make use of data that is collected outside of the hospital setting in the natural environment of people and use that to inform and improve decisions that is related to health. And with this effort, we hope that eventually our efforts will lead to better health and reduced cost of care. This is a new journey that we begin, and we certainly would love to have your support and your best wishes as we embark on this important endeavor. Thank you.
Due to Dr. Collins' schedule, the NIH director's schedule, this meeting was moved several times, and it turned out that we wound up with a date that President Rudd could not be in town for. But he was kind enough to generate a brief video for us, and we'll get a chance to watch that now.
Let me apologize for not being able to join you today for arguably the most exciting research announcement in the history of our great university. Let me say congratulations to all those involved. Let me say thank you to all those involved. I'm excited about where this opportunity is going to lead the future of the university. I'm sure that you're excited about where this opportunity will lead. I look forward to some great things ahead. Let me say thank you, and most importantly, let me say congratulations to some fabulous work. Go Tigers.
We do have a number of people I'd like to quickly introduce. We have several elected officials in the audience. If you'll just raise your hand so that we can acknowledge you. Representative Cohen. I think a representative from Representative Fincher's office. But we would like to ask Representative Cohen to come up and make a few remarks. Steve Cohen has been a great supporter of this university, and more than that, a great supporter of research at the University of Memphis, and we have appreciated all he has done for us.
Thank you very much. Andy, you've done a great job too, and I appreciate the introduction. Dr. Kumar, I'm most proud of you. Thank you very much. I am a University of Memphis law graduate and a University of Memphis supporter of athletics in the school since I was like 5 years old. I remember coming out here to the field house a long time ago, and you name it, doing it. But I'll tell you something I'd never seen and never thought I'd ever see. Never have seen and didn't think I'd ever see. Memphis, with this class of universities. Is that special? Northwestern, Rice, UCLA, UC, Michigan, Amherst? That is impressive. Thank you, sir. That's a little data, but it's big data. He said, big data, I thought you were talking about Patrick Lynch and 351 yards. That's big data too. This is the real big data. We're here to educate people. And we're here, as Dr. Raines picked the slogan, thinkers, dreamers, doers. Well, with the Tennessee Promise Plan that the legislature passed, they're more interested in doers. This and the Hope Scholarship is about thinkers and dreamers. And thank you for thinking and dreaming. This project's going to be great. And the NIH, Dr. Collins, you know, he was the head of the Human Genome Project. You mentioned that with big data. Dr. Collins is a star. I support our military, and I supported our defense budget this year and supported our position on with ISIS and the need to be effective in controlling and limiting their ability to have a caliphate and threaten freedom and democracy everywhere. And I know that there are threats from Iran and there are threats from Afghanistan and threats in Ukraine. So we need a military. But the likelihood of any one of us dying from an attack from one of those countries, is slim. But the odds of one of us dying from cancer or heart disease or stroke or diabetes or Parkinson's, AIDS, Alzheimer's, very likely. So where should our emphasis be in our budgeting? The Department of Defense, where they admittedly have more money than they need and can have, they've got weapons to destroy weapons to destroy weapons, or the National Institute of Health. In my opinion, we need to do both, but we need to realize Francis Collins and the Dr. Kumars of the world. They're our generals. Our Department of Defense is the NIH. And I have sponsored a bill, which I will continue to sponsor and speak out on, to take monies from the Department of Defense, $1.55 billion. The NIH was cut by $1.6 billion in the sequestration, and put that money in the NIH. Our Department of Defense, the one that's going to be our Defense Department, men like him, Francis Collins. So thank you, University of Memphis. Thank you, Dr. Kumar. This is a great moment for our university, and to be there. How many schools are there? Like, I didn't count. 9? 11? Well, I'd say we're in the top 10. Congratulations and thank you.